Trahan, for what purpose?
I move to strike the last word.
Gentlelady is recognized. 5 minutes.
You know, time and again, I've heard my colleagues across the aisle discuss the urgent need to address the youth mental health crisis in our country, yet they ignore the fact that a large body of medical literature demonstrates that with support at home, in school, and in communities, coupled with access to gender-affirming care, trans youth show improvements in mental health outcomes. A high prevalence of suicide ideation and attempts occur in transgender youth compared to their cisgender peers, but in transgender children who have been able to receive gender-affirming care, risk of suicide is reduced by 73%. Denying that truth means denying the existence of trans kids as a whole, and how dangerous is that? We should be working to increase access to health care for all children, not restrict the ability of children to define and express themselves. A ban on gender-affirming care is dangerous, it's misguided, and yes, it's cruel. And it is a shame that Republicans on this committee are, one, misrepresenting what gender-affirming care actually is, and using what should be a bipartisan piece of legislation to score cheap political points. Now, I want to emphasize that across pediatric practices, many young people who are not transgender access gender-affirming health care for one reason or another. For example, a Harvard Medical School study found that for decades, doctors have been using safe medications for cisgender children who go through puberty too early. For trans children, gender-affirming care is essential, medically necessary care that promotes their health and well-being. This evidence-based care is used to treat gender dysphoria, which is a serious medical condition characterized by clinically significant psychological distress associated with the difference between a person's gender and the sex they were assigned at birth. Gender-affirming hormone therapy and surgeries are deemed medically necessary treatments for gender dysphoria by the American Medical Association and other clinical policy-setting organizations. GAC is patient-centered and treats individuals holistically, aligning their outward physical traits with their gender identity. What my Republican colleagues are not saying is that this kind of care encompasses many facets. Social affirmation is considered gender-affirming care, where a transgender person adopts an affirming hairstyle, clothing, name, and pronouns. This affirming care occurs at any age, but what my colleagues may be referring to, gender-affirming surgeries, are overwhelmingly performed in adulthood. In fact, Boston Children's Hospital in my home state of Massachusetts only performs these procedures on consenting adults, contrary to misinformation that's peddled online, including by a witness who the majority invited to testify before this committee. Overall, gender-affirming care is comprehensive care that affirms the individual and meets them where they are. And by exaggerating the care that's actually being administered to trans children, we're opening them and healthcare professionals who work diligently to care for them to increase levels of hate, harassment, and threats. I've seen that already at Boston Children's Hospital, which has been the victim of numerous threats following the spread of misinformation about the services operated at their facility. Let me say something that should be obvious to my colleagues across the aisle. Embracing rhetoric that endangers our children's hospitals does nothing to protect our children. It does the opposite. It puts them at risk of not being able to access the life-saving care that these facilities offer. So let's stop with the partisan gamesmanship, the uncredentialed grandstanding, and let's get to work on funding programs that children's hospitals rely on to train the next generation of pediatric specialists. You can do it for your children, you can do it for mine, and the children that you hope to have someday. I yield back.
Gentlelady yields back.